Good morning.
Well, good morning. Happy Tuesday, May the 7th. We're going to get into a full day of budget hearings. Lorian, take it away.
Good morning. Just one note on our schedule change. The clerk is going to be joining us today. He'll be our last presentation. Very graciously agreed to move so that we could free up some time tomorrow. But we'll be starting with the Division of Public Services. We'll be on page 453 of your binders. I'm going to hand it over to Tim Kaufman.
Good morning, Tim.
Good morning, Chairman, Commissioners. Thank you for this opportunity to discuss the Public Services budget request this morning. I have three experts with me in their respective fields today, and I want to thank them and their staff and our budget analyst, Lee McCrae, for the work that's gone into this budget request. A couple of weeks ago, the county manager gave his 3-minute version of Local Government 101, and he emphasized the relationship between the unique relationship between counties and state government. And all three of these programs that you'll hear from today are great examples of that relationship. They do work on behalf of and in coordination with different state agencies, and they also work with third-party payers, including managed care organizations and insurance companies. And the employees do different things. They have different models, but they implement in a way that they are part of or manage a local system of care. And they do that, on behalf of state agencies and in response to community need and community request. They all deliver some level of direct service, but again, they're managing or being part of a larger system of care in the community. You're going to hear budget requests totaling just over $99 million, but 17% of that request is based on local tax dollars. Almost $82 million comes to the departments as earned revenue, grants, and contracts. And because compensation remains a priority for each department, there are very few decision packages, and those that you will see are tied directly to ongoing staffing challenges. Before you hear from the departments, I'm going to discuss two different funding agreements related to public services, and I want to show the division workforce strength. I know that you've seen a lot of green from other departments. Departments within public services are still challenged with staffing, and they'll show you in detail some level, but this is an improvement from two years ago. And this reflects an additional 135 employees in the last 2 years. So that shows a couple of different things. One, the efforts that you have supported in terms of pay have made a big difference, but we had a massive deficit in terms of staffing. And so we've made lots of progress. There's still room to grow, though. Within this budget, there's also two different, there's a community programs budget, and with that, it is discretionary, and we fund two different community organizations. The Child Advocacy Center, we help fund their operations, and then the Mental Health and Substance Abuse Coalition, we're a part of a consortium that helps fund their operational costs again. In terms of their challenges and opportunities, there continues, unfortunately, to be an increase in demand on services, particularly at Child Advocacy Center. Their financial resources are primarily grant-based, and they're seeing increasingly complex and difficult cases, and they need additional resources to address those needs in the community. Their capital campaign to expand their facility and increase the volume of services is well on its way, in large part to the contribution that the Commission made at the end of last year. And the Mental Health and Substance Abuse Coalition has made some significant progress in terms of building momentum in terms of diversification of funding, and that's encouraging to see. That request remains flat, $251,000, and again, that's all discretionary. Any questions about community programs? Okay, I'm going to turn it over to Joan and let her talk about CommCare.
Good morning, Commissioners and staff. Joan Tammany, Executive Director of CommCare. Always Always a pleasure to present at the VOCC budget hearings because it's our opportunity to highlight some of the things that are going really well and where we're still facing challenges. So I'm going to move to the one first. I think, we should have put these first, but back in April of 2022, we were dying on the vine. I mean, literally, we were 40% down in our workforce. All of us were working round the clock. We were just burnt out and tired, and a lot of staff stuck with us, but ultimately made decisions for their own mental well-being to move on. So we've been in a regrowing period for the last 2 years, and you'll see that most everything was in dire situation that time. We are better. We did make gains, particularly this is our scale from April of 2024. Our main gain was between April of 22 to April to 23. That's where we saw a 23% increase. From April of 2023 to April of 2024, we initially made a 1% gain, but now we're back down slightly. So we're still challenged with workforce. You could see we have red, which is not something we ever want to see, because that means we have to make decisions about who we see first and who's a priority. Red across the board in our crisis service line. This is a service that has to be available 24/7. It's very difficult for us to staff after our positions, and weekends are even more difficult. A lot of our positions are exempt, so when we ask staff to step up and help us fill shifts, they're doing through the graces of their desire to help our community. They don't get compensated for that extra effort. And that's a problem because we're still red. We're yellow in some of our other service areas. You'll notice that yellow under children's, yellow under medical services, and red and yellow under crisis services. Those are our professional staff positions. Those are mastered level clinicians and our medical staff. So we have a ways to go. It's significant progress. We appreciate all the progress we've made. We appreciate the support of the CCBHC pay plan and other activities geared toward recruiting and retaining, but we have a long way to go in terms of getting to a comfort point, because we still have to cover vacant shifts. We still have to make sure that we create a safe environment for our workforce, and we have to be inviting and welcoming to the community that comes in to see us. Okay, so Tim mentioned this, but ComCare, like the other public service departments, were predominantly funded in means other than the general fund or tax dollars. You'll see that our greatest area of strength in terms of revenue is tied to our revenue funds. These are the dollars we collect for delivering services for people that have Medicaid, self-pay, or some form of insurance to receive services from us. Our percentage of grant dollars from the state is our second largest revenue source, and you'll see that in total, county support equals about 9% of our budget. So when I speak to our issues on the next slide, which is our discretionary or our mandatory, this is specific to what's in our general fund. We have 52 positions through the general fund. They're in these areas, and you can see that the only ones that are mandatory under the general fund are our oversight of our outpatient services and our administrative operations. Those are necessary, but the rest of our general fund programs are discretionary, and those include our mobile crisis, some of our mobile crisis services, ICT-1, the 18th Judicial Court, administration through our addiction services, some of our offender assessment program, which originally were designed as jail alternatives through CJCC, and then our Housing First program are all discretionary. I will say Tim had mentioned any of our areas of red are where we focused our decision packages, so you'll see that connection as we move through this. So everything else we do so all of our other services are required. They're required through our certification as a certified community behavioral health clinic and/or by statute as a community mental health center. But those are not general fund positions. But I do want to make that distinction. And with the Certified Community Behavioral Health Clinic, we have some obligations to keep growing that service line and be accessible and of quality to the community. So honestly, we have more challenges than we do opportunities, but the opportunities we have are pretty remarkable. So I'm going to start talking about opportunities first. So CanCare is the Medicaid managed care system in the state of Kansas. They went out for bid. We're expecting an announcement of who those 3 or 4 or however many they select new managed care entities should be identified publicly by the 17th of the month. There is opportunity there because when they went out for bid, one of the things that was really important for the provider groups, of which we're all part of, is that they released us from some of the administrative burdens like prior authorizations for everything we do. So the opportunity there is maybe they'll be easier to work with than our current structure of managed care entities. We are in the process of working with our association on the implementation of a data warehouse. One of the things that as a certified community behavioral health clinic we have to achieve is the use of data to drive decisions and to demonstrate our success, not only locally and at a state level, but most importantly at a federal level. And that data warehouse will allow us as an association to data mine our own data and not rely on an outside source to do that for us. So that's we're going to be the first one to go live with that. And as we progress through the year, the other CMHCs will come on board with that data component. I do have several that are going to be in blue because I have those on both strengths and opportunities and challenges. So we are in the process of building a new crisis center, right? So that's really an exciting opportunity because the goal with that new crisis center was expansion, but even more than that, the accessibility for the entire community. So real exciting. We also have opportunity because we're having to move our children's services in the next few months. And hopefully we'll have some facility efficiencies with that. Another one that's both a strength and opportunity, I'm going to talk about the opportunity here, is the increased community pressure to do more and to do it better. So there's just a constant demand and an ongoing relentless demand for behavioral health services, and we serve a unique population. We're not private practitioners. We're not picking and choosing who we serve. We're here for anybody that seeks and accesses services. So lots of opportunities to be creative under our certification as a certified community behavioral health clinic. In general, the whole focus on data is a strength. Another opportunity is as we continue to have need for services is the ability to expand. Sorry, I'm going to grab a water if I could. A combination of talking too fast and allergies.
Happens to me all the time, John.
Right. Excuse me. We see technology as important to our future. We're still looking at how to implement new technologies, but one of those that's coming down the pike pretty soon for us is 988 text and chat. We're in a process now of exploring that and costing it out with the state and looking at training. Substance use services, we kind of fill a unique niche here in Sedgwick County. We serve the people who have co-occurring mental health and substance use disorders, where most providers can't and don't do that. So there's an increasing demand for that, and we want to be here to fill it. We currently do medication-assisted treatment for opioid dependence, but we see continued growth and opportunity for that in partnership with SAC. We also see opportunity to continue advocating for funding for medical detox in our community so people don't have to go to the hospital as a last resort for that service. And quite frankly, our biggest opportunity is as a certified community behavioral health clinic. We have met full criteria for that, but we now have to move from meeting criteria to be a thriving organization. And that's a real exciting opportunity for those of us working in the field and recognizing that certified community behavioral clinics are known as centers of excellence across the country. And Kansas should be really proud of what we've achieved as a state. And then I really think we have opportunity to improve our communication networks with the community and internal to our organization as well. Sorry for not keeping up the pages. But then we have our challenges. So I'm not going to go into a lot of detail on this, but for years and years and years since the development of community mental health centers, which were intended to be mental health reform, it moved people from state hospitals to communities, and there were some privileged codes that came along with being a community mental health center that were protective to the CMHCs in isolation. And that's because you had to have sufficient resources to deliver the array of services that were necessary to keep the state hospital patients in the community. You had to wrap supports around them in ways that other entities weren't able or willing to do. A decision was made at the state level is now that we're certified as community behavioral health clinics that they were going to open these codes to the general public, to any willing provider type. That is going to create a lot of chaos. It's going to create a lot of cherry picking, and it's going to create a lot of scattered care because people are going to pick the highest reimbursement codes to deliver, and yet those may not be the service codes that somebody needs to stay out of a higher level of care. So that's coming July 1. It's going to be a challenge for us. The facility issues, while exciting, building moves never occur as you want them to. I saw Tanya smile because we're still struggling through our children's move. And it requires a lot of intentional thought, effort to build in efficiencies and changes. Sorry, guys.
Oh, you're good.
The other challenge we have is when our crisis center is built, it was intended that we would also increase staffing, which would require an increase in infrastructure as well. Considering the vacancies we have now, it's hard to imagine filling even more, but we'll get there. Again, that increased community pressure to do more and do it better. While it's a great opportunity that I talked about just a moment ago, it's also a little stressful and anxiety-producing to never really meet the community expectations because they're so diverse and vast. It's hard to meet them all. We also have a challenge that one of the core principles of community behavioral health clinics is care coordination. And we are just now filling some of those positions, and care coordination is kind of that wraparound support to make sure that they serve as extenders to our professional staff to make sure that they're getting access to, for example, primary care or other social supports and things that have to do with social determinants of health regarding food insecurity, et cetera. And then our biggest challenge, of course, is workforce retention and shortages. It's more than just a recruitment and retention issue for us. There's a national shortage of behavioral health professionals. So we need to continue to focus financially on those solutions. And then another challenge is our off-hour shift coverage. Mobile crisis response and our other crisis services require a 24-hour continuum of coverage, and it's hard to do. Some of our partners are already talking with us about expansion of our alternative co-responder models and those are for after-hour shifts as well. And this one has changed. I talked about the fact that while we saw a 23% increase between 2022 and 2023, there was only a 1% increase from 2023 to 2024, but that has since we did that original analysis, it's gone down some percentages. And there's just a lot of new provider agencies coming into town. They're for-profit hospitals, particularly around serving seniors, because we have a growing population over the age of 60, 65. But there's other people who are in it for the paying customers. So those are usually centers that can pay staff higher rates and provide a more comfortable, easier population to work with, because everybody that goes to those centers are usually voluntary and are seeking services for themselves, where we serve a lot of population that are not necessarily here other than with the influence of a probation officer or a family crisis. And then we are seeing an escalation of aggressive patient behavior that is not due to their mental health issues. It's due to the substances they're coming in with that create a lot of impulsivity. And when they wait more than a few minutes, they start getting agitated. And we're seeing more damage to our facilities, more damage to windows, doors, that sort of stuff, and fear. Those are fearful experiences for staff. And if you get enough of those experiences and you decide it's not the environment for me, what happens? They leave. So making sure that when we build our new facilities, that they're designed to provide space for people who are in a psychiatric crisis, and we can separate them.
Do you mind? There might be a couple questions here. Go ahead, Commissioner.
Thank you. On your second bullet, it indicates that the salary helped us from 22 to 23, but now you're saying that we still need more market adjustments.
Yeah.
Or could that be that all of the people that are eligible, that are qualified, have been hired by somebody, that there's no workforce out there? So
when I'm part of the Behavioral Health Center of Excellence, which is a group that was formed locally to start looking at workforce challenges, and we're meeting with all of the academic programs in the area as well, and they're saying they're graduating large number of people. There are people graduating. It's just, when you start looking at public sector work, it shrinks your pool of candidates, and the work is difficult. So we're hearing it's a combination of both. Is there ever going to be enough, 100% enough? No, but are there more that we can recruit and hopefully retain? Absolutely.
my worry is just in the future on making sure that we have the workforce we need for tomorrow. That's why we're starting the biomed facility and other things like this to make sure we grow it. So I don't want to just focus on salary, because I think there's a workforce problem too.
It's a combination, but we know when people are leaving, they're saying, and now the explanation they're giving us is, while the salary itself may be competitive, it's not competitive for the nature of the work that's being done. It's hard work. It's very complex work. It takes time to get skilled up. So salary is one pedestal of that stool that has to be tackled. But I do think we have opportunities still in that respect.
And if I could just add, we're creating a committee for the mental health board to look at workforce. And so if you'd be interested in joining that, we would love to have you be part of that conversation on a larger scale, as we're talking about how are we going to staff the hospital. So I'll follow up with you.
And I think that brings up a very important point that I meant to clarify too, is we literally have a 1.5 year lead time before that state hospital is here and hiring. They're looking at hiring 368 positions if they staffed all 104 beds. That's a huge workforce. I mean, that's almost as large as our workforce. And where are they going to come from? They're going to come from community providers, because when I asked the question, even if they privatize, do they tend to bring people in from outside, or are they local? They said they're local. So we have a short window of opportunity to shore up community-based services before another competitor comes in town.
I appreciate that insight. I'll switch gears just a bit on your fourth point there about aggressive patient behavior. A lot of it is drug-induced psychosis and some of
Yes.
these things. Commissioner Lopez and I recently toured St. Joe's Psychiatric Behavioral Health Unit, and they talked about their staff was victims of 2 attacks a day on average. Do we see something similar in our crisis?
Yeah, we do. I mean, the other day we had somebody who got transported back from Osawatomie State Hospital. Somewhere before his discharge, they informed him his family didn't want him home, and he had that long drive to ruminate. He broke through our front door and then proceeded to break through one of our therapy hallway doors before we were able to even stop him. Staff said it was the scariest day of their life. Can you imagine the force to break through those steel doors we have? Yes.
Well, I wanted to just draw on that point of the aggressive patient behavior, that this is something that's common in psychiatric and behavioral health across the entire spectrum, and that
Yeah.
as we think about workforce and think about these things and,
Yeah.
and honoring those individuals, it's a tough job. So.
It is a tough job, and thankfully, most people that come to work for us come to us for the right reason and recognize that their behavior is sometimes not under their control. But again, you get a new green clinician or a case manager out of school, and they've not been exposed to any aggressive behavior. That's pretty overwhelming, and we think those are some of the unspoken reasons people leave, too. Okay, so our budget request, our general fund, out of the 61 million comes to 5,402,771. Most of our funding comes from grants from the state and other fee for services. So pretty straightforward asks there. When we talk about our budget requests, these are related to personnel, which is the bulk of that funding. We do have contractuals. There is a significant shift from 2024 to 2025 for the contractuals from 14 to 16 million. That's due to 3 different reasons. That's due to the way administrative or indirects were identified this year, increase that rate, but also we know that there's going to be increased lease rates with our new children's location, and with any move and damage to property, we'll have some furniture to replace. So those are the 3 things that change the contractuals. But overall, our ask goes from 56.9 to 61.3. Again, bulk of it being fee-for-service related. Directly linked to the areas of red and the challenges, our decision packages, of which I have 3, are pretty known to you. We are asking for a CCBH pay plan salary adjustment of $982,554. Those are for the CCBHC pay plan positions. We base that amount as a 4% increase over general salary adjustments from actual costs from 2023 for salaries. That, again, is trying to hit that one leg of that stool for staff recruitment and retention. And again, that was 4%. And then I know we're talking about these issues, but I have a real challenge on holidays and weekends and after hours. And I know that after hours is being addressed, but we have a decision package request to increase weekends and holiday pay for predominantly our staff at our crisis and our Sedgwick County Offender Program by either to $5 an hour adjustment for non-exempt, and for exempt of $50 a shift. And then we are seeing success with our Grow Our Own. Here's one of those other 4-legged stool things that we're working on, is similar to EMS, if we can grow our own and provide the opportunity for folks to get their advanced degree and do master level therapy work, then we're ahead of the game. We have 6 positions currently. 1 is scheduled to graduate at the end of summer. We have several graduating next year, but we have no more positions to fill to keep that momentum going, so we're asking to add more in order to continue to have folks enroll and participate in that academic opportunity. Yes.
On that last one, is that, how much of that would be out of a general fund versus help state support?
It would all, that's excellent question. With the exception of a few positions for the after hour and weekends, this would come from the general, this would come from our revenue, all of this would come from our revenue fund.
On this one?
This one,
Okay.
plus the other
But
two, with the
previous
exception,
one, yeah.
with the
previous-
exception of those that aren't on the, that there, we have a few positions in the general pay plan that might be impacted by a salary adjustment or after hour weekend.
Okay. So I assume our HR and our finance group will be able to make sure that that's explained to us as we process on through this.
Yes, so we have a 5% pool in the forecast, right, for pay adjustments
Okay.
generally. As things like this come up that are funded, that we would basically reduce the rest of the pool that would be available for general pay adjustments to make up for this. And so Sheena is going to have part of that conversation with you all at your compensation workshop later this week, and then we'll continue to have that discussion over the next month or so as we put together the finalized recommended budget.
We've gotten into a bad habit this year of having compensation decision packages. That needs to stay focused to the compensation discussion, which we will give you independently from operations and everything else we're talking about. We'll rectify this going forward, but these are all legitimate issues that the directors are bringing up. But I think that we wait and hold that discussion for the compensation discussion. We'll throw it all back at you on Thursday.
Okay. Then, as long as I have the mic on the red spots with the crisis world, remind me where, and then you kind of mentioned it just a few minutes ago. Where are we on the I mean, use the word credentialing or whatever? Is it still, you got to be a super credentialed before you can fill that spot? Or
It depends on the position. So
working?
if we have an integrated care specialist, they can have a bachelor's equivalent. But if they need to do a mobile crisis response as a clinician or a therapy or screening for state hospitals, et cetera, they have to have a master's degree and a license through the
And is there
state.
still state guidelines that are trying to be adjusted? And do we as a commission need to support that adjustment on our
Yeah, we're
on our
making
agenda?
we're making progress with the BSRB and trying to reduce the barriers to people getting those licenses, but academically they have to achieve a certain level of competency to be able to do that work. So reducing it too far doesn't produce quality outcomes. So it's a balance, but I think we're okay. We've got enough groups fighting for that, and the BSRB is aware of it. But thank you.
Thank you.
No more questions. Well, then I'm going to turn it over to my wonderful peer, Annette.
Oh, wait.
Actually, I do have some. I thought there was more slides. I apologize. I do have a couple questions. Is that okay?
Sure.
So I'm trying to connect the pie chart on slide 12 to the budget breakout on page, I should say, slide 18 and 19. And I don't see how they. I know this is all funds, and you have it both by personnel, contractuals, commodities, and transfers on the one page, and then the other page you have. On slide 18, you show the source of funding, but the numbers don't seem to line up. Is the funding by revenue source on the pie chart on slide 12, is it a different, why is the data different on these two pages?
Because you have to, Kathy might be able to explain this better than I do, but you have to, the budget process is a little unique in that it's not actual, so the information on the pie chart are actuals for the last year. And our budget process is estimating potential revenues and then trying to adjust for cash, other things. Kathy, is there another way to explain that?
No, you're accurate.
So they're they're a little bit two different measures in that respect. These are actuals.
And Commissioner, you might look at page 457 of your binder.
Okay.
So to Joan's point, what you saw in that pie chart are actuals, and so you can see how that compares in our prior year actuals But then when it gets to the budget, for example, for 2025, between all funds, there's a $61 million expenditure budget with a corresponding $56 million revenue budget. And so this ties back to, again, there are positions that are on the staffing table and things
Yep.
like that where we don't actually expect to spend the money, but the budget authority is there because of how we budget. And so I think that's part of the gap there too.
Yeah.
So I guess I have two other questions. It's not clear to me what parts of our comm care services are mandated by state law, which ones are discretionary. I know you did that on the community programs, but what about the rest of what has been presented today? How much of that is considered mandatory by state law versus local decisions or discretionary spending?
So most of our services are statutorily required as a community behavioral health clinic, and then through our certification as a community behavioral health clinic, but they're not in our general fund. So there's a lot that would be on that mandatory piece if we were talking about our entire budget that aren't listed there. So it would be all of our clinic programs.
Are there some things we do that are discretionary though, that are?
Yep.
Yeah.
We do housing, some of our partnerships like with the mental health courts and the drug courts, those sorts of things are discretionary.
If I-
Best practice, outpatient treatment court.
I thought housing was a part of a CCBHC requirement, one of the 9 or so requirements.
It is, but I was talking about our Center City program through HUD.
Oh, understood. Forgive me.
Okay, then what's not clear in your budget proposal today? Maybe it's clearer in the budget book, but in terms of property tax dollars, how much of the total budget that's been requested today is property tax, and how does that change between 24 and 25? Is that broken out somewhere, Lindsay? Where is it on page?
457, you'll see the general fund budget is 5.4 million.
And I think,
I think it's on one of your slides, but easier. There you go, yeah.
Okay, the 5.4 at the top.
Yes, sir. And then you can see the Comcare, the $19,200 for this year was cleaning up. So there continue to be delinquent taxes and things that are paid that are posted to the original fund for which they are levied. And so as that balance continues, we have to get that cash out of the fund. And so 2024 includes getting those dollars out of the old Comcare tax fund and into the general fund now that it's a consolidated into the general fund. But that was a tax fund as well.
I also saw on your staffing chart that you're talking about ICT 1-5. Do we have any data on how that's, maybe not today's presentation, but it'd be
Yeah.
nice to see how that's going?
Yep, happy to share that. Yep, we track a lot
All right,
every
thank you
month.
very much. That's all I have.
Okay, any other questions for Joe?
Okay, Annette, up
As
to your
always,
slide.
thank you. Good morning, Annette.
Morning, Commissioners. Annette Graham, Department of Aging and Disabilities, and thank you for this opportunity to present to you today for our, as you realize, we have a new name. We used to be the Department of Aging. Now we're the Department of Aging and Disabilities, with the change effective July 1st, moving the CDDO under the department, the consolidation. So I'll start with our workforce slides. You can see for 2024, as of April 1st, we still had a lot of yellow, some purple, and some actually red. So in the aging, specifically in the aging side of things, with our grant-funded programs, those do have some very specific requirements for staffing. They have to have very specific degrees, much more so than ComCare, and they have only certain degrees that are acceptable. And then there's certain types of experience in working with older adults and people with disabilities. So that makes it a little bit more challenging. And because the pay scale didn't raise as much as they did on the clinical side or in corrections, we still have a lot of competition for staffing with those 4-year degrees. So you'll see some of the result in that. Then we still have those red in certain areas. Our Older Americans program, the diabetes nutrition, some of the mill levy services, we still have some. Some of those have been challenging to fill, and then our administration. So we still have some challenges there that we're working with, but it is better. Now I've separated the next two slides in two because Sedgwick County CDDO was separate in 2022. So you can see that in 2022 we had some red in a couple of places there in their administration and quality assurance. So we certainly have seen improvement there from what we were experiencing in 2022 relative to the pay increases that we've experienced during that time. And then in 2022, we had a lot more red in the Department on Aging. And 2022 and 2023, we really struggled with getting staff, with hiring. Our wages were really very non-competitive, and that was really problematic. And so over the last 2 years, we've experienced the results of those staff shortages with slowdown in being able to provide the services, provide the requirements sometimes with some of our grants. So we've had to work with our state partners to get some exceptions and some extensions for certain programs. So we are appreciative of the changes that have been made, and they have made some significant impact on our staffing level. So that is good, that we're doing a lot better and we're being able to fill more positions and better able to meet some of the requirements of those grant programs and provide the necessary services to the individuals that we're responsible to provide services for. So overall, it's been good, but we still have some ways to go with filling positions and struggling with some of that wage issues and competition with other departments and other private entities. So here's information on what is mandatory, and this is under the mill levy side of it. So when we look at this, there's really only one that's mandated, and that is for, under the CDDO side, the crisis plan really is the only one, because as a CDDO, the agreement is with the state that a CDDO is responsible to ensure that there is service availability in crisis, and to make sure that we're working with our affiliates to make sure that they have the capacity and that they're willing to serve. So that is really the only service that is mandated. So discretionary, you'll see here we have all of the current programs that we're contracting with community providers to do, and a couple that are internal. So we've got adult daycare, Alzheimer's respite care, critical assistance program, legal services. So these are all of the ones that we primarily work with our community providers, and then you see the senior centers, the transportation, and all of the physical disabilities that's funded under the general mill levy, and those are the services that we contract out with community providers. So there is no statutory requirement to do any of those services. So that's kind of how that looks when we look at our aging and general mill levy funded services. So moving to our 5-year challenges and opportunities, and start with the challenges. So as I referenced, that we have seen those salary increases have been impactful and have been very helpful in helping us to be more fully staffed to provide the service. It, however, does lead to a budget imbalance because the majority of our funding is grant funding. And those grant funds have not increased to cover those increased salaries. In fact, they stay very static. Our Older Americans Act program has not really had a major increase since 2001. And our admin dollars stay the same. Under our Senior Care Act program, which is another one of our big grant-funded programs, the amount of money for the administration stays same every year. It was about 4 years ago that there was some increase in the overall state budget, so that was helpful at that time, but it does not grow. So the majority of our grant-funded programs and contracted programs, the admin is set and it doesn't increase. So that leads to some imbalance as those wages go up. It's harder and harder, and we will begin to see the impact of that probably. We're already going to see it in 2025. We're going to see it in 2025, and that's impacting our budget and our budget projections. So if there's, we're going to be trying to look at some different ways to address that, but if that's not addressed, eventually what we'll see is we're going to have to reduce staff and we'll have to reduce services because there will be no other options with the pay amount that we're needing to pay. We do have continued growth of the aging population. So we're all aging. You're all aging. You're all going to get there if you're lucky. So you're all headed towards that golden age. And in fact, so the boomers, born 1946 to 1964, have been impacting the population grid for several years. However, this year, next year, and the following year are the peak years for the boomers to hit that magic age of 65. So we've been saying ever since the boomers started hitting that it's 10,000 a day nationally. Well, for the next 3 years, it's 11,000 a day. People are turning age 65. So that was kind of an interesting new data set that I've seen. So we're seeing that across the nation. We're seeing that here. We will continue to see that. And in fact, by 2034, yeah, where am I at? By 2034, yes. We're going to set the Wayback Machine. By 2034, for the first time ever, United States will experience more people age 65 and older than those that are under 17. So just think about that and how that's going to change the fabric of our society. For many years, we've talked about our society is built for soccer moms. That's just a saying. But, it really is when you look at housing and subdivisions and planning and school funding and all of that. So when we look at that, just, see in the future, things will be changing. And we can't really know how that's going to change now. But, all across the system, service delivery, taxes, volunteerism, the workforce, working with an older workforce and figuring out ways to retain older workforce, because 65 doesn't look like it did when I first started in this business at all. People are aging, they're living longer, they're healthier, more and more people are working past the age of 65 and planning to work for many, many years. They want to continue to contribute, they have lots of skill sets, and they're great employees. Just saying. Think about that when you're looking at. So we're seeing that, but the fastest growing segment of the population is age 85 plus. The fastest growing segment because we're living longer and we're healthier. Now, at age 85, that's when we start seeing people are beginning to have some functional impairments, some mobility issues, some other types of chronic health conditions, which is when they tend to need more services and might need help to stay in their homes, which all governments local, they're at your doorstep. That's coming, and it is here, and we're already seeing that. With some more complex needs. They're showing up with more complex needs. The other thing that happens with the age 85 plus population is the opportunity many have to outlive their resources. So they are more likely to need, you've got the increasing cost of housing and taxes and insurance and medication and medical treatment, and that impacts that static level of funding and resources and savings. So we're seeing more and more of that, and we'll continue to see that moving forward. Another interesting thing that we're beginning to see at the national level, and many are talking about this now, and it's happening also locally, is the increasing number of older adults experiencing homelessness. And I've heard that the age 50 plus population is the fastest growing population among the homeless. And we're seeing people in their 60s and their 70s that have been housed and had resources and had jobs. But one incident can happen. You can't pay your tax bill. You've got a medical condition. You're in the hospital. You can't pay your bills. And then it just spirals, and people are ending up homeless. And and the homeless service providers aren't prepared to deal with that population. They don't have the resources. They don't have the skill sets. They don't have the kind of facilities and service needing. So I think that over the next 5 years, we're really going to be seeing a big increase in that. Unfortunately, people that are renting, the rent's going up so much that they can't afford to continue the rent, and then there's no other places for them to go. People that can't pay their taxes, then they end up there. So that will be continuing to see something that we need to be looking at as a community, and how do we deal with that. And when we move to the CDDO side, addressing the needs for mobile crisis service. So we know that we have a lot of situations where there's this intersection of individuals with developmental disabilities, having mental health issues, having complex health conditions, and they're needing some mobile crisis service. They're needing some more, higher level of services that's currently available out there. Sometimes they end up inappropriately in a hospital and they just get overboarded there and they just get stuck in the emergency room. Sometimes they're in the jails and there's not a service option for them. Sometimes they're in the group, in their facilities or in their own home, and there's a there's a lack of resources, there's a lack of clinicians that are specially trained in how to deal with that population, because it's a very specialized need, and that is a big issue that we're continuing to see grow.
So if I can,
Yes.
So the dual diagnosis situation is something Commissioner Dennis and I have talked with frequently with you and with Starkey in particular, and Tim. What is the magic bullet here?
Well, I've got some opportunities I'll be
you're going to flip the
presenting
slide.
to
Okay.
you. So, not that it's a magic bullet, but that is something we're looking at. So, stay tuned. I'm glad you asked that question.
Well, thank you. There's your transition.
So that definitely is a challenge. The next one is the capacity of community service providers to be able to meet the needs of we're estimating about 100 people will be coming off of the waiver in Sedgwick County.
Out of how many?
Pardon?
Out of how many do we have right now?
We have 500 on the waiver,
Got
about
400.
500.
We got 400 we still don't have service for.
Exactly.
Thank you.
So the state legislature did authorize and approve, and has been, I believe, signed by the governor. 500 people will be coming off the waiver statewide. And out of that, we anticipate at a minimum about 100 from our area. So that will be coming off. The other thing that was has a recent change is that the waiting list will be capped at 4,800. So in addition to those people coming off the crisis service, coming off through crisis and the waiting list, that there will be a cap. So that will be, the challenge is making sure that our community affiliates have the capacity. Some of that capacity really is related to workforce. So
How can they
that
morally
continues to
cap
be.
it when there are people that need the service? How can you cap people going on to that?
Well, right now the waiting list is at 5,000. They're moving the people up, but in the legislature they're capping it so that there can be no more. So when people are coming,
The question is, how can you morally cap it when you've got people that need the service?
And the goal should be to serve them all, right? That
The
goal
goal
should
has to be to serve them all. If you've got an IDD need, we need to be able to service those people. We can't just say it's capped and, well, you don't count anymore.
State of Kansas. Right?
that's a state, and
So
yeah.
That's another item for our agenda next year.
Can you solve that problem?
What slide is that?
Yeah, what slide is that on?
That's a funding issue. Yes, so that's the answer. It might be taxes.
Annette, before you, Annette, before you leave that slide,
Yes.
on that last bullet, can you talk just a little bit about, now that 100 people are coming off the waiting list, what that does for our providers here locally, and is there any impact you see budgetarily on that issue?
So, what we are doing is we are, at this point in time, we are beginning to look at the people that are on, the state maintains the waiting list, the statewide waiting list. So they have given us the dates that we need to be looking at the people that are on that. We are working with those people now to find out, because we have not assessed them since they went on the waiting list. So going out, talking to them, going to be doing a new assessment, but also looking at when they were assessed, what their needs were. Did they have mobility needs? Granted, it's been a long time ago, but beginning to look at that. And then we're going to be scheduling and doing the basis assessments to see what their needs are. And then we've also at the same time are working with community providers to talk with them about what is your capacity, what are your needs, what resources do you need.
So you will be getting the funding from the state to give to providers to take on that capacity.
So the services will be reimbursed by Medicaid.
Okay.
They will provide services that are reimbursed by Medicaid. We have heard, not officially, but that the state will have some money to help providers to build up that capacity. And then we do have some reserve funding and other funding that we can use to help them. But one of the things we're looking at, is that there are service capacity already in the community. We have 92 beds available. But we don't know if these people are already residing with their family members already housing. They might not need housing. We don't know. They might need day services. They might need, in-home services. They might need adult day. So there's a lot of work going on that. There was also some additional funding that was put in by the legislature for the supported employment, transitional employment. They're making some changes in that, but there was some additional money that went into that. Now, so that's all something we're looking at, but we believe that there's enough funding and resources available to help develop the capacity, except for the one issue, and that's workforce. And many of us share that same, problem, is trying to find the workforce and figuring out, the last couple of years, the legislature has done some work to increase the reimbursement, the funding rate. So that has been helpful, and hopefully that will continue to be. And then we work with some programs with WSU for the badge program to help do some, and there's an apprenticeship program that InterHab has done, and they're working on expanding that to move that more into the high school age group. So there are a lot of things going on to try to address that. So opportunities, I'm going to start on the aging side. So there is, through the Veterans Administration, there's a service called Veterans Directed Home and Community-Based Services. So it's kind of similar to the Medicaid waiver, but it's for veterans of all ages. And that is a program that's, the template and the service model is a VA model. And we have looked at this model off and on over the years through our state association and tried to get into this. But now the federal government has required the VA to start doing this. So we're working with our state association, developing the model and how to implement that in our area. So we're looking, is that an opportunity? The VA hospital here, Bob Dole Hospital, Robert Dole, serves the majority of Kansas, and we know there's a lot of veterans who need this. This is a self-directed model. The area agency on aging staff would be reimbursed for going out, doing the assessment, developing a plan of care. Then the money is paid through the VA, and the vet pulls together their self-directed care team. So that would be a good opportunity for expansion, and it is a model that actually pays fairly well. So we're looking at that as an opportunity, and hopefully within the next 6 months to a year, that would be coming to fruition. We have also, we're one of, I think, about 12 or 15 area agencies on aging across the nation that were selected to be in the Administration for Community Living Community Care Learning Collaborative. So that's working with a group of area agencies on aging across the nation to look at these successful models and to learn from consultants and the Administration for Community Living how to develop models to go out and market to health plans and insurance companies to do direct services for older adults to address their social determinants of health. So there's a lot of good models out there, how you can impact and reduce hospitalization, rehospitalization, because we know about 70% of your health is related to social determinants of health, not the medical care. So it really is working in that space, and that's a space that really area agencies on aging are very skilled in. So we're looking at that as an opportunity moving forward to expand our services and in a service model that actually help pay for administration costs. So now we move to the IDD, so the IDD Community Support Waiver. So to your question about the waiting list, there's been a lot of talk about this for the last couple of years in the legislature, and the state of Kansas has agreed to do this. They now have a grant writer. They're writing a grant, and the Community Support Waiver is kind of like a modified Medicaid waiver program, and that doesn't provide all of the services under the IDD waiver, but it provides a more limited number of services to move some people off of that waiting list who don't have the full array of needs. So they have worked with CMS. They will be submitting this. CMS is aware that they are applying for this, and the goal and the target date is that this would start 1/1 of 26. So this, in addition to moving 500 people off the waiting list and capping the waiver, then you have this new model that will be coming in to help provide additional services. So that is a good opportunity, and one that we are watching very carefully, and that we will also be working within our community and our providers as that kind of comes out and comes to fruition. So that's exciting to really begin to see the state making some commitments to move people off the waiver. In our community, we'll see less people waiting for services. And then just one thing to know about that waiting list, because Kansas has such a long waiting list, people, oftentimes we're seeing parents put their children on the waiver. They're waiting for services. They don't always need those services when they're putting them on, but they need to secure their slot. They need to secure it for in 10 years when my son graduates, he's going to have some services. So I just as you look at that and look at those numbers, understand a little bit that not everybody on that waiver waiting list would need services today if offered. So that's just kind of a helpful thing to have, in the background when we're looking at those large numbers. So as I said, we anticipate this is also an opportunity to really be able to impact at our community level, getting these people into services, working with our providers, working with them to figure out ways that we can help build that capacity, ways that we can help support them to effectively and appropriately serve individuals who are in need of those services. So when we talk about that mental health, the intersection for IDD and mental health, one of the things that we got last year was a grant for a crisis stabilization from KDADS. So we were working on this, and one of the main thing we were doing with our grant for this year, and we're talking with them about having the grant again for next year too. But we've asked, it hasn't been released yet, but we've talked to them about what we would want. So this is the START. It's called the START model, which stands for Systemic Therapeutic Assessment, Resources, and Treatment. So it's a national model. It's in 14 states. It's been around for a very long time. It's been very effective. There's lots of data on it. And what we're doing is bringing that to our community. We're going to start at the systems level and bring together law enforcement, people from the jail, community, clinicians. Joan's got 3 staff that are going to be involved with this. We've got some behavioral analysts, ABAs, that are going to be going to that. So we have kind of at the systems level to come in and start talking about this model and to help them understand the service needs and the service population, and to get then to do a community assessment to see what the needs are, and then to start training clinicians on how to deal with this population, because it's a different population, and a lot of times clinicians do not feel comfortable because they don't have training. So it's just some advanced knowledge, some information to help them feel comfortable in modifying their approach and their clinical service delivery to be able to meet the needs of this population, because it is different. So we're really excited about that. And that's going to be starting very, very soon. And then what we're hoping to do in the next year is really to take that to the next level. We're waiting to see what the state says, but that's really kind of a bricks and mortar kind of service where people can go. And people can get the services and get kind of stabilized and get some work with the providers and work with their family members to help them modify and identify so that that crisis doesn't continue to escalate or to continue to happen, be able to learn how to do that. And then there was an RFP that was put out for a statewide mobile crisis service for this population. So this is really exciting. It's a 3-year grant. We were working with the group that's writing the grant that was submitted, I think, last week, and we would be partners on that. I've talked to Joan about that, and she provided a letter of support. We provided a letter of support. So it would be taking the START model statewide, but then also training mobile crisis units and working with mobile crisis units, the 988, and working across all of those levels to move this to a statewide service delivery through training of clinicians and EMS and mobile crisis units. So that's pretty exciting to see that happening and much needed. So here we go to our budget. So we have the general fund budget, what was 2024 and 25, aging services, our aging grants, and the CDDO grant. We see a small dip in the aging grants. There's, moving away from the ARPA grants. This is the last year for those. And then a slight increase in the CDDO with some additional grants there. And then we have kind of broke down for all funds, how those funds are being utilized. You'll see this equipment, $100,000. And what that was the vehicle purchase that was supposed to happen in the previous year, didn't, because the vehicles were in back order. We moved that money to this year. So that is why you see that $100,000 change there.
Okay, very good. Any questions for Annette? Pretty appealing opportunities there. We appreciate that.
Yeah, thank you. Now I will bring up Adrienne and let her speak about that.
I'll just say this, Mr. Chairman. I did send out a story to a few of you regarding the wait list, IDD and PD wait lists. There's a story just came out today that clarifies the governor did. There was a proviso added to the budget, and the CAPS portion apparently was line item vetoed, but the legislature overrode that. But there's getting a lot of praise from the IDD and PD population for doing what they did do. There's 1,000 folks being taken off the list this year. It's 500 PD and 500 IDD. But there's a lot of praise because this is a step in the right direction. So I don't view this as a negative thing. They can always appropriate more money in future years. This cap is not forever. It's for this year. So it moves us in the right direction.
Very good. Appreciate you sharing that article. Well, hello, Adrienne.
Good morning,
Welcome.
Chairman, Commissioners, Board of Health. Adrienne Byrne, Health Director. So 24, here's 22. We've made a little bit more progress than what we can see on there. We have hired 3 staff since this time, 2 of them in the purple area, and so that would be yellow at this point. And it is important to note that 4 of the positions counted in the denominator for immunizations are surge positions that we have available for times like flu. So the pay increases have made a difference in retention for sure. But the 2 areas, or the main areas that we continue to have concern over, are with our licensed staff, namely, or specifically dietitians and nurses. You'll see that under mandatory services, we do have 3 by state statutes: epidemiology, sexually transmitted disease control, and TB control. And then on the other side, over underneath discretionary, the top 4 are locally funded only, and the bottom 6 are, 5 of the 6 are a split funding between grant and local, with the exception of preparedness, which is all grant funding. So our challenges, so hiring and retaining bilingual staff to serve a growing Spanish-speaking population does continue to be a challenge, particularly because their staff in the same position are getting the same pay when they are doing interpreting and a fair amount of dialoguing. So we're finding that that's very much a challenge. A budget imbalance in grant funds for salaries because of the health salary increases, because our grant funds continue to remain flat. And then hiring nurses, as I mentioned, we have 28% of our positions are vacant, and particularly with registered dietitians, it's historically been a challenge to hire dietitians, but even more so since COVID. So challenges, as we experienced with COVID and H1N1, when there's a pandemic, funding flows in, and then when the pandemic is over, it pretty much dries up. So we need really, in all local health departments, but funding for infrastructure with monitoring diseases, preparing for and leading during public health emergencies, connecting people with resources in the community. And then during COVID-19, a lot of people got pets. And then because they were home, and then people went back to work, and we have found that there are a lot of pets that have been abandoned. And for whatever reason, whether they're unable to or just unwilling to. So we have been working, our animal control staff work a lot with our partners, and this has increased to identify and develop strategies to reduce the number of unwanted, neglected, or euthanized pets. And as a result, their caseload and complexities have definitely increased and continue to increase. So opportunities. In 2023, we were one of 40 local health departments in the U.S. that were awarded the Overdose Data to Action grant, and that is a 5-year, $5 million approximate grant, and 4-year public health funding through the Workforce Development Grant, which is through KDHE, and that was approximately $800,000. And we're really working on, really focusing on connection between our electronic system to be more efficient and effective in the health department, and also what we can with our partners. There's a varying degree of resources that our own partners have. They might be collecting data just on a spreadsheet. Some don't have any kind of systems to really report data. So we're going to be looking at what we can do with that. And we are working with our division of IT, who will help us with this project in our efficiencies. And in 22 and 23, we began working with our partners, our medical and health partners, and then others that we connected with during COVID, and gathered, I think there were 80 different partners that came to the initial meeting in 22 to look at areas that were a strength during COVID, and that areas that needed to be improved during our COVID response. And we continue to meet with those partners. And one of the projects that have come out of that is in 22 and 20, or 23 and 24, they were focusing on a new and improved health emergency operations response. And some of our partners had not been in the EOC. Many had not really been trained on how those responses work, because we ended up during COVID being the primary ones that were pushing out information. And it really needs to be a much more collective situation where partners will be sharing their updates very briefly, what their challenges are, and then we can look at what the needs are collectively in that group. And summary, you'll see the general fund and our grants, 24 revised and 25 requested. And then just a summary of the categories of the funding. And then 65-35 split between local funding and grants. Short and sweet. If you have any questions, be happy to answer any.
Commissioner Dumas.
Thank you. Adrian, you mentioned in your briefing 2 places. One is mandatory to do tuberculosis testing, and also you go back to your staffing table and tuberculosis is in red. So I'm in the community a lot. Is that a widespread problem in the community? Because I haven't heard of anyone that has tuberculosis.
Well, thankfully, it is not a widespread problem, but it's still there. I mean, so we still, and we're not going to, if something is containable, then we don't let the public know because there's no risk. So there's disease investigations that go along with this. There are a lot of people that are latent carriers of TB, so it's inactive, but depending upon their health, it could become active. But we do have a small number, about 8 TB cases approximately each year, and they're managed, and we do what's called DOT, direct observed therapy, so that we ensure that they're taking their medication so that they are not dealing with TB anymore.
Okay. Well, on the slide, I think it said that you have 5 authorized and you got like 3. Do you need 5?
No, one of those positions we are warehousing because of a app that we have now that helps with monitor people that have latent TB. So we are warehousing a medical assistant, and then one of those positions we are getting ready to fill.
Okay, go back to the other slide, 'cause this is from the 2022. See, there it shows 3 out of 5. That's what the one I picked up.
Yes.
So should we redesignate those positions if you don't need 5?
Well, one is being warehoused, and the other, yes. We're going to be doing some restructuring where we put TB under our clinical services, where all of our clinical nurses are, and so we're going to be looking at what we need to do with that additional position, because right now we have 2 TB nurses and then an administrative support.
And on this slide, this is what you have actually authorized for FTEs. It doesn't include the ARPA positions, correct?
That's correct. That's correct.
Thank you. That's all my questions.
ARPA lives in finance. You'll see it on our slides later this afternoon.
Okay. ARPA lives in finance. Yeah, Commissioner.
Thank you, Chairman. I'm just curious, on the same slides that Commissioner Dennis was just talking about, in 2022, we were green for immunizations and health screenings, and now we're down to red. We've lost 3.5 FTEs in that area. Is there something going on that needs an explanation there?
Well, with the immunizations, that is one of the areas that we have 4 surge positions. So actually we are at 100%. Those surge positions are on the staffing table in case we need additional help, like during flu season.
So it's not really red then?
It is not really red.
Okay, thank you.
Easy answer. Okay, any other questions? I think we're going to get a summary from Tim. Is that what?
So, again, $99 million, about 17% of that request is for local tax dollars. And there are decision packages. I think to Commissioner Meister's question, about 80% of that is represented in the grant fund and the revenue fund. So a little bit of that would have a general fund impact, but we'll talk more about compensation as we go.
Very
So-
good.
Oh, there's that one slide.
there it
from
is
Linda
again.
Baker right there.
That was good, yeah. Okay, any questions for Tim? Okay, thank you, Tim. Thank you guys so much. Rusty was clapping, that was good. Lorian, what's on the docket? There's a request for about a 10-minute break, but what's on the docket for the rest of the day?
A lot. Next, we'll have administrative services, and then we have technology review board. We have sheriff, DA, finance and community development, county manager, and county clerk.
Okay. And then lunch, yeah.
Lunch in the middle, yeah.
Okay.
I have a very important lunch date.
Yeah, very good. Okay, 10 minutes and then we'll reconvene.
Okay.
My daughter and I are meeting for lunch for her to vote for the first time at the Hayesville City Meeting. Nobody really
Back live. Thanks for the break. Back in we go. Lorian, take it away.
The Division of Administrative Services is next. We'll be starting on page 168 of your binders, and I'll turn it over to Tanya Cole.
Okay. Good morning. We are here to present on the Division of Administrative Services. And so this great looking crew next to me here, you'll be hearing from this morning. And so that is Central Services Director Corey Stokes, Courthouse Police Chief Daryl Haynes, Fleet Manager Director Bo Bergeron, Facilities Director Andrew Diltz, and Parks Superintendent Aaron Bailey. I'm going to talk just briefly, and then I'll turn it over to Corey. But I do want to spend some time on this workforce strength slide. I'm going to toggle just real quickly because I do want to show you the colors between and the difference between these two slides. You can see that we were, for the Division of Administrative Services, we were a lot in the red in 2022. And then I want to just toggle back to where we are today. So I want to show that in Central Services and Fleet Management, we had some stability between those 2 years. We are at 96% in Central Services and 93% in Fleet Management. I do want to focus on courthouse
we are at
police.
96% in Central Services and 93% in Fleet Management. Services and 93%
I do want to focus on courthouse
we are at 96% in Central Services and 96% in Central Services and 93%
I do want to
So I want to give my gratitude because I think that the work that you all did in compensation as well as the manager, finance, HR, and the leadership team, your support is really evident right here on this particular slide.
just seeing that increase in the workforce strength. So just thank you to you.
We're grateful
and
too
your
for
support.
your guys' work.
Yeah. So from here, I'm going to turn it over to Corey, and he's going to talk about Central Services, and then we'll just continue through each of those departments, and then I'll come back at the end. Okay?
Hey, Corey, welcome.
Good morning, Commissioners. How you doing?
Yeah.
All right. Like Tanya said, our workforce is about 96%, which is stable from what it was in 2022. Different parts of the department have fluctuated between here and there, but we're pretty stable and pretty strong. Our mandatory discretionary for mandatory, our records management department is mandatory, governed by statutes. Discretionary, we have the mail room, print shop, and the 2 call centers. Our challenges and our opportunities, I think over the last few years, we've been able to develop a training plan which is usable and repeatable. Over the next 3 to 5 years, we want to kind of stabilize that and help make the department stronger. One of the things we're looking at doing is developing a quality assurance program. This way we can start recording some of our phone calls and listening back to them in order to perfect our responses. Overall, we're looking at just over $3 million for 2024 on a revised budget. It's a decrease this year. We're looking at just over $22,700,000. And this is our total request for the entire department. I'll stand for any questions.
Short and sweet, bud.
Short and sweet.
Yeah, very good. Any questions for Corey? Appreciate you, man. Morning, Chief.
Good morning. Okay, we have a relatively small budget, 1/3 of 1% of a county budget. On our staffing, we have had some improvement. We have an increase from 2022 of 16%. And so we have made progress. I think the Evergreen study has helped us. And we'll go through the challenges here in a minute. As far as mandatory and discretionary, the county commission is responsible for providing security for the district courts as the county commission deems necessary and proper. And so we're part of that. And so we do the screening of people coming into the courthouse, the screening of persons coming into the juvenile courthouse. We patrol the courthouse campus and respond to requests from the Reagan building, from public safety. We go up to OMD and in the general area there. And we also patrol around the area of the juvenile courthouse campus. We do protection from abuse and a protection from stalking dockets. So we are dealing with some pretty unhappy people on a regular basis, people that by law can't be anywhere near each other. We put them all in a room on Thursdays and expect them to get along and ensure that they do. We maintain the campus after hours to prevent crime and disorder. In the discretionary, we also patrol to prevent and to minimize leaks and water damage, things that happen of that nature. We follow up on criminal charges with people that we arrest that are new cases as opposed to warrants. The vast majority of cases we are on our arrest are for warrants. We assist the sheriff's office in making arrests in adult probation and around the courthouse, keeping things in order. Discretionary, we mentioned patrolling after hours. We patrol the Ruffin building. We monitor and screen county commission meetings. We administer the Fast Pass program, which lawyers really like for getting into the courthouse. They go through a screening process and they're issued a pass. We administered the Genetec camera system used by the county, and we also administer the INET and security expert access control system. We actually just converted from the 1993 INET system to a modern security expert system. We're going through a few hiccups in that conversion, but that's to be expected. We're doing pretty good on that. And then our challenges, recruiting and retention, is what I'm sure you hear a lot. It continues to be an issue. Older officers retire, other officers and supervisors have left for higher paying jobs. I think that the recent pay increases have helped slightly with recruitment, but with inflation, we're still behind most of the other small police departments in Sedgwick County. And our officers were happy to get pay increases due to the Evergreen study, but there are some that complain that they are nowhere close to pay parity with the other county law enforcement entity, the sheriff's office. We're struggling sometimes at maintaining and modernizing equipment. A lot of the police equipment has 5-year warranties or expiration dates, including tasers and bullet-resistant vests. Our budget is relatively flat, and continues to be that way. We do have one decision package, and that is because our x-ray machines in the courthouse lobby, we have two of them. We're asking to replace one of them. Both machines are 13 years old and no longer manufactured. They are under a service contract, and the service contract helps us survive with these machines. But the problem is, since they're no longer manufactured, sometimes it takes a long time to get parts and bring them back up if one of them goes down. And the request is estimated to be $45,000. Of course, we'll have to go through purchasing and that process to do the replacement. So $45,000 is a reasonable guess on replacement cost. And any questions?
Okay, thanks, Chief. Any questions? Chief, help me understand compensation over there. Can you, starting wage, or help me, what is starting wage for courthouse police? And how do you guys?
For a commissioned officer, it's in the 18s. I can't give you the exact number, but I'm sure Bethany can right back there. But
Jump in.
Yeah.
For a service officer, I think it's $16.45, and for a police officer, I think it's 19, maybe 15 or something like that. I've got it over here in my book. I can grab it for you real quick.
I think that's helpful.
Okay.
Okay. Any other questions for Chief? Okay, thank you, sir.
thank you.
One second. Bo, 1 second. Tanya, maybe you can help. I got one more question for courthouse, please. Sorry, Bo. There's been some investments in, I think, ammunition training, uniforms, vests. Where does that money come from? And is that a 24 budget implication, or is that a 25?
Sure. So let me go back if I can. Okay. Police officers, I was close, 1914. And then service officer starting pay is 1654. So to answer your question, courthouse police, they had asked for new uniforms, kind of a new branding. And so finance and the manager were able to help me to get funding for new uniforms. And so they're going to be rolling this out this year. They're going to be having soft uniforms. And so they are in the process of getting fitted right now. And so I would say probably in the next 2 months, they should be able to have actually new uniforms. With that also, they'll be getting new bulletproof vests. There were some that are getting close to expiration this year, so they are getting fitted for new vests. Additionally, they also Lizzie was able to put in $5,000 additional dollars for training for courthouse police officers this year as well. So that's been added to their budget this year.
24 budget?
Correct.
Got it.
All of that is for 2024.
Okay. I think that's helpful. Any other questions?
Just one question. Do the courthouse police, do they get to train at the LETC?
Daryl,
Do you guys get to train at the Law Enforcement Training Center,
at the
WSU?
Law Enforcement Training Center.
I'm sorry, I didn't hear this.
Oh, go ahead.
Are they able to train at the Law Enforcement Training Center, so WSU? Yep. Yes.
And one other question, what do you do with the old bullet-resistant vests?
The people,
Come here, Daryl. He asked, what are they able to do with the old bulletproof vests?
they have to be destroyed once they're expired and not usable anymore.
Okay, all right, thank you.
Okay, that's all my questions. Thank you, Chief. Bo, sorry for the delay, but welcome.
So we're pretty constant over the last, well, from 22 to 24. What this doesn't show is 23, we had about 3 vacancies for quite a while, but we've caught up to that now. Everything is pretty much discretionary. Management of fleet services, overhead for fleet services, fuel services, vehicle replacement, preventative maintenance for all the equipment, body damages, new vehicle setups, and we manage all the funds for the sheriff aircraft. We are still dealing with supply chain issues and rising costs. It's not as bad. The 10 police Durangos we ordered in February are arriving tomorrow. So but we're still waiting on some stuff we ordered in 23. So technology in vehicles is constantly changing, and we are trying to keep up with that the best we can. We do as much training as we can with the technicians to keep them up to date with that technology. Trying to retain as many as we can. Pay's going up everywhere else, so we're always fighting that. We're still working on updating shop equipment that hasn't been updated in 20 years, but we're on track for that pretty well. And then we're still looking at cost-benefit ratio of leasing fleet vehicles, but that's probably not going to be in the near future. Budget is $12.2 million with a change of negative 1.9, and there's the breakdown.
Okay.
Any questions?
Okay, very good. Any questions for Bob? Easy. Thanks, Sarah. Andrew.
Good morning, Chairman and Commissioners, your Facilities Director, Andrew Diltz. Overall, our biggest impact here between a couple years ago and today was in our maintenance department. And I do want to thank you guys for your support and helping us get that resolved. Project Services remains in purple, and we also had our custodial, hired a couple more on our custodial team, and admin stayed fully staffed. Here is the slide from 2 years ago. You can see the difference in the maintenance with an overall increase of approximately 38%. All of our mandatory, everything mentioned here on the mandatory side is not a state statute. These are other government agencies that have requirements that we must comply with. So this includes the ADA, which is federal at the very top. We have a number of City of Wichita inspections. One of the items there is suppression systems. The suppression systems for the data center, most of that is coordinated by IT, and we are limited in what we do on the data center suppressions. The rest, all those fall under facilities. And then we have state of Kansas inspections with the fire marshals, KDOL, DCF, KDHE. And then we have a number of discretionary things that we also perform for a number of our facilities and grounds. On our 5-year horizon, challenges and opportunities, we've had some stabilization in rising costs and construction materials and labor. It's still somewhat volatile with the amount of construction projects that are happening in the area and what the workforce here is going to do for us, and with upcoming projects, and whether or not that's going to drive the cost up is still unknown, but we're kind of watching that. So we continue to deal with equipment obsolescence, things that we can't get parts for, that we have to replace. We continue to have space planning, whether or not we're expanding and what opportunities we have to utilize remote work and try to consolidate buildings. That includes leases as well. And then we have extreme weather events. So fortunately last night came and went, but a few years ago there was a bad winter storm that impacted supplies for plumbing issues, impacted supply for contractors. So we leaned on our staff pretty heavy for that. Overall, our 2025 budget is just shy of $8.9 million. That's a decrease from 2024. We do have a decision package. This is for a security specialist. Basically what this individual is going to do, and I may lean on Mike and Rusty for any of their help with this, but basically what this person's going to do is maintain the camera infrastructure that we have in all of our facilities. So this is going to include the jail, which is currently has a project to install an additional approximately 800 cameras which adds a camera in every cell, and all the servers, the hard drives, the cold storage units, everything that supplies all those cameras and the infrastructure for those cameras. We also have that at juvenile detention facility. We have cameras throughout this building. We have cameras at the courthouse, and a number of other facilities. This person would basically go and maintain those cameras for us. Currently, the way we're doing this is with maintenance staff, and since there is a level of IT computer knowledge when it comes to cameras and servers and things of that nature, this position is being created to help relieve some of that from our staff. I know Daryl, Chief Haynes, maintains the Sandifer system at a number of his buildings, and we're frequently calling Sandifer and other vendors for help with these systems. We also have multiple softwares that we have to learn to operate the system or retrieve footage in the event of a situation that occurs. We have to provide security footage to a department on what happened that is going through maintenance at some of these facilities. And so this person would take on that role.
I do have a question about that. So I guess I was assuming on this decision package that this individual would do the hardware, the actual cameras, maintenance of that. But you're saying that this individual would actually be responsible for the footage that's on there as well? And
this person's going to be responsible for both. It's going to be hybrid. So if a camera has an issue, they're going to go out in the field, they're going to fix the camera, resolve the issue there. If there's footage that needs to be done or software issue, our anticipation is that this individual is going to be able to sit down at the computer, provide the footage that you need, or go through the exercises of trying to retrieve that footage for you.
Okay.
I'll let Rusty or Mike go.
Oh, Mike, I just assumed that was your department that did things of that sort, but.
Yeah, one would think, because there is a lot of technology behind it, right? But no, today it's being maintained by facility staff and Chief Haynes and his staff.
Okay.
And this, just to be clear, this is an FTE, but we would rely on more than one person to do this. So
Big lift,
just
yeah.
like we do for everything else that we support, right? So if somebody has a life event or a sickness or takes a vacation, right, we still have resources available to support.
Okay.
Well, we have, particularly in the juvenile facility, the sheriff has a large staff. He has a lot of support staff. He has people that they have an Axon system, and they have, whenever they need to pull evidence off cameras, whenever they need to pull video footage off cameras, he has technicians in his department.
Okay.
Corrections has not necessarily had that. They have backup for the maintenance person that maintains the servers and works with the contract and the company that provides the cameras. It's piecemealed.
Mm-hmm.
And it's come to light that when we have incidents, it's not good to have to rely on the sheriff to manage footage from corrections. And it just makes sense that we centralize this with a number of cameras and audio and all of that we centralize it. We have a technician. If there's stuff that needs to be subpoenaed for court, we have a technician who can say, I'm a technician, I'm trained in this, this is how this happened.
I think that's what I was getting at, Rusty, is I wanted to make sure we all understood that this is more than just installing cameras and making sure they're pointed in the right direction, that there's a multi-department function here that'll be housed out of facilities, but this is a pretty big job.
I don't think it made the Lofton task force list, but it made our list. That's something that we knew when we struggled after that event, just to retrieve the data and get the data out in discovery mode. It was difficult, and we learned right there we need to streamline this and make this more professional. I think that's what the goal is.
Good. Okay.
I'd like to add to this that while this is a facilities decision package, this is a joint effort.
Yeah,
this won't be added to our staffing table. This will go to Mike's.
I appreciate that. I didn't notice that until this conversation, that this is how big and broad this actual decision package was. So I wanted to make sure we were able to vet that out.
Decision package total is just over $88,000. I will stand for any questions.
Thank you, Mr. Chairman. We'll go back 2 slides. And the ADF and JDF, those we've got contracts going to install all those things. Where are we at on that?
So we have contracts to install the cameras at the jail as part of the construction project. But after that construction project's complete, is that what you're referring to?
No, I want to know where are we at in the contract first.
Oh, I'm sorry.
That's my first question.
The jail, all the product is on order. They are making the locks, and we're anticipating a start date in July for the jail. And for juvenile detention, the cameras are shipping. We're basically starting with one room, installing the cameras the microphones and cameras, and then we're going to listen to the audio, see how intelligible the audio is on the recordings, and then make a decision on whether or not we have to do acoustical upgrades. And we're starting with one room at juvenile detention.
So it's going to be a year probably before we have all those installed, right?
Yes.
And so what's the warranty period? Aren't they going to take care of them for a while? I'm trying to narrow down. My questions are going towards this position eventually. But aren't they going to maintain them and do anything that's required for a period?
They will maintain, so our 1-year warranty will take effect at completion with the general contractor. And basically, they're just going to warranty any of the hardware that they install. The software is not going to be warrantied by them, and that's only on the new equipment. And we have a number of existing systems that this position would take care of starting next year if this is approved.
Are we going to need a contract to maintain the software also?
We do have a contract. So I believe we have 3 different softwares right now. We have a software that runs the jail and the jail annex. Chief Haynes has a software that runs the courthouse and other government buildings, and then we have a third software that runs juvenile detention. So all 3 of those softwares are under contract. A lot of the hardware that we buy, we have to buy through those vendors. Otherwise, they won't warranty it. They won't help us set it up. So we have remote support. The only vendor that's local is Sandiford, which helps Chief Haynes in the government buildings. The jail annex, and JDF, they're out of state. They have a number of jails all over the nation. So we only have remote support with them.
Okay. Well, now working towards this position you're asking for is what I was building up towards. Do you need it? We're working on the 2025 budget starting in January. Do you need this position in January, or a lot of these things aren't even going to be online in January? When is the date that you need this position?
We would take advantage of this starting today if we had somebody on staff.
Okay. Good. And then my final question is, ever since I've been on the commission, I've been trying to get all of our IT stuff over into IT and away from all of the departments. Why are you asking for this instead of the TRB?
I mean, it very easily could have gone to the TRB. This is just something that I'm asking for because right now it's a burden on our staff. And so we're trying to relieve that burden off of our staff. And
I have no problem with relieving it off your staff. I just think that it's going in the wrong place. I think it belongs over in IT because my problem ever since I've been on the commission is that we don't know what we're spending on IT because it gets spread out. And now we're trying to spread it back out again. I'm trying to centralize everything with IT in IT so that we know what the cost of IT is for the entire county.
This position will end up on the IT staffing table. It's only being presented by facilities because they're the ones that maintain it now.
Sounds good. Thank you all.
Well, we got there, didn't we? Andrew, thank you so much for all the work you guys. You've been busy lately. Appreciate you. Okay, we got next. Okay, hey Aaron, welcome.
Good morning. Aaron Bailey, Park Superintendent. Good morning, everyone. Workforce strength. Currently, we're sitting at, I'm not going to try to read that. We're at 98%. We were at 72. We've had a 23% increase. Pretty easy to get up to a high percent. We have a fairly small department. So, onto the services we provide. The only thing that's under mandatory is the community fishery assistance program. That is something we do with the state of Kansas so that folks can fish at our parks without us charging them for permits. Under discretionary, it is things like the maintenance of the campgrounds, the parks themselves, the facilities that we have, shelters, rental buildings. We sell vehicle, boating, and camping permits. We do operate a bait store, bait shop. We sell licenses there as well. Our challenges and opportunities. Parks usage has remained steady. We are seeing an increase in the number of events and rentals that we have at our parks. I think the public is really utilizing the space. But with that, my staff is telling me that they're seeing some changes in the way that the public does use the space. We're seeing a lot more trash making it into the dumpsters and not making it into the dumpsters. So some of the challenges are just keeping up with the way the public is using it now, changing to meet that. Some of the opportunities we have in addressing those challenges are policy changes, code changes, rule changes, looking at how we offer things, what we can do differently to help provide the best parks we can, meeting our mission of providing safe and attractive parks. And then we are also currently seeking to complete a master plan and potentially do that in conjunction with a strategic plan. And what we want to do there is really just look at our space, what we have, what the public and other stakeholders would like to see at our parks, and just making improvements. And potentially, if there's things that we could move away from, we would do that as well. This is our total budget. We have about almost one. Well, it's almost 1.3. Some of that is from the Special Parks and Rec Fund, as you see there. This is just a little more detailed breakdown. And we do have 2 decision packages. The first one here is for that master plan. We would like to have an updated plan of how to best utilize our space, what we need to be looking at, what we can do differently. The request was for $50,000. And then our second decision package, this was something that comes up from the public quite a bit, and that's the sandburr stickers at Sedgwick County Park. And here we've looked at a specific pre-emergent that is labeled for parks use to specifically target sandburr stickers in warm season grasses. And that chemical is quite expensive. That's why we put it in as a decision package to add to that budget line. But with that, we can treat a large area around our playgrounds, the open spaces and that sort of stuff, and hopefully get things whipped into shape. Decision package totals here of $54,000 approximately. And that's all I had, if there are any questions.
Those stickers have been a thorn in the flesh for everybody in West Wichita for a long time. Did you get that?
I got that.
Yeah, good. Go ahead.
Sorry I got it, but I did. Anyway, thanks for coming and briefing this. You have 2 decision packages. Both, I think, are important. We need a strategic plan so we know where we're going in the future and what we need to do to make sure that the park stays one of the assets that we have. And the sticker is the big problem. I brought it up yesterday when Public Works was briefing us. So they'll help us get the chemicals we need, I think, at a reasonable price, won't you, Lynn?
We don't carry those specific chemicals. We can work.
Very good. Anyway, I do support them. I get a lot of phone calls and emails. Main thing is on taxes. The next thing is on zoning, but the third thing is parks. And so I forward them all. Tanya, oh no, she's over here. I'm sorry. Tanya gets the brunt of that every time that I get questions about what's going on in the parks. So if we're going to keep the parks as an amenity, and that amenity is something that drives quality of life in this area, which drives our economic development in this area. So it all kind of flows together. So this is the reason why that I place a pretty high priority on making sure that our parks are a great asset for this community. So I don't see a problem with these two decision packages that you have. Thank you.
I have a question, Aaron, probably for you. Might lean into you, Commissioner Dennis, Tanya, and Tim as well. How closely aligned will this strategic plan, this community plan, particularly for Sedgwick County Park, the master plan, forgive me, with the zoo's master plan? Obviously, Sedgwick County Park, a big part of that section of land is Sedgwick County Zoo. Do you work hand in hand on the master plan piece with Sedgwick County Zoo? And it would seem that those two would be aligned in maybe some direction.
I think that they've historically been separate. I mean, the lines are drawn fairly clearly. There's some partnership opportunities if the zoo needs access, for example, through the park at some point in time with their access. But I think that because Aaron came from the zoo, he's got a different perspective and a helpful perspective on what the zoo has plans for and what may fit with the park.
Very good.
And there are several different organizations that all work together on this. First of all, Public Works is a big part of making sure that we take care of things like the trails and so forth in our parks. In addition, the zoo, and in their strategic plan going forward, there's some pretty cool things that they've got in the strategic plan to put in, hopefully a hotel at some point, maybe a carousel, maybe develop around a hotel if we can get it in a savanna. So we've got spaces that we can grow. So that's going to take a part of Sedgwick County Park as we move forward. But that's all in the 25-year master plan, so it's the future ideas that are coming forward. The neat thing, if I go back to the zoo, is that when they put things in their strategic master plan, they've got the people on their board that make it happen. So I can see some of these things coming to fruition in the future that are in that plan, because if you walk around the zoo and you look at the naming that's on everything in that zoo, those were all people that were on the board, and they thought that it was important to happen, and they make it happen. So I think some of the things that are in there, I think most of it is actually going to happen in the future, which will impact Public Works and the Parks Department.
Very good. Thank you. Commissioner Howe?
Thank you, Chairman. Just curious, does the master plan have anything to do with the ball fields out west of the zoo? I know it's leased out to, go ahead.
I didn't mean to interrupt. The West Urban, the Twin Rivers, and the AYSO, it's my understanding that that's all leased. I would assume that we would obviously look into that, but I don't know why we would want to change it.
The consideration for the master plan is for Sedgwick County Park and for Lake Afton Park. We certainly know about the leases that are contained within that west portion of Sedgwick County Park.
So with the master plan, I guess I would really implore us to do something with Northeast Park. I can tell you that there's a bicycle trails group that would really like to have access to the south side of that Northeast Park. They would like to be involved in developing that. They need permission and signage and that type of thing. But Northeast Park, in my opinion, is underutilized. It doesn't necessarily take taxpayer money, at least not very much, maybe for some signage. But what they need right now is permission. And
correct me if I'm wrong, the master plan, strategic plan is Sedgwick County Parks, which would be inclusive of Northeast Sedgwick County.
At this point, we're only including Sedgwick County Park and Lake Afton
I think
Park.
that's a correct, then good statement then, Commissioner. I think we ought to include that. That has to be part of the discussion. On the county park, on Sedgwick County Park, there's 4 moving pieces there. There's the zoo, the park, the soccer, softball complex, and extension center, all in that landmass there. So any discussion of master plan, strategic plan should include all 4 of those moving pieces, so we do this correctly and have good communication, and we'll all work together to make sure that happens.
And since we're on the back end of the dam jam discussion, I am curious about the liability aspects of these parks. If someone gets injured in one of these parks, do we have some type of liability that I don't know how that works. The fact that someone's using this park, is there some kind of implied?
We'll need a counselor's interpretation of that. Justin's not here, but I would almost guarantee you that there is some culpability with when you own property and you are running facility at properties, there's some culpability.
So with that in mind, again, I want to continue to consider the idea that, much like ASM, if we have a contractor manage these parks for us, I don't know if that shifts that liability towards a private sector operation, if you will. You guys do a great job. I'm not saying that. What I'm saying is, I'm not sure that the Sedgwick County government needs to personally manage these parks when we potentially could consider a contracted management company to take care of these parks for us.
I think, Commissioner, if I could jump in on that. So the way ASM Global took over for the arena was that there was a profit sharing deal. I think we would have to find a way to make this contract competitive and or pay for the service to manage it. We cannot, though, shift away our liability as the owner. Just like with ASM Global, it's still our facility. We still approve capital improvement projects. We have not, well, we have a unique relationship through the management agreement. We can't completely absolve ourselves of liability just by going with a contract. And we can have Justin do a deeper dive into that for you, but that is unfortunately not the complete solution.
I'm not against a competitive bid contracted service for any of these parks. I think we ought to take a look at that as part of our plan. So again, not saying that we have a bad situation today, but in terms of trying to find a competitive management company that would potentially deliver better services. Again, Chairman, we just had the en banc meeting trying to reinvent how we do things. This is part of the discussion we need to have. All right, thank you.
Appreciate the feedback. Anything else, Ryan? Thank you, man. Appreciate it.
Thank you.
Okay, Tanya?
Okay, I'll just close the presentation. So in summary, we have 4 decision packages, one for courthouse police, the x-ray machine, facilities was the security specialist that would move to IT, Parks Department, which you just heard, which was the master plan, and the Parks sandburr sticker control. So in total, you have to come over here, 187,932 and 1 FTE. And then total budget request for all 5 departments under the Division of Administrative Services, just under $27 million. I'm happy to stand for any questions that you might have.
Very good. Any questions for Tanya? I think you guys covered it well.
Thank you very much.
Thank you. Appreciate everybody. Okay, Lauren.
Okay, we have one more presentation this morning. It's the Technology Review Board. We'll be on page 611 of your binders.
I didn't even notice how many people came in. I was like, oh, there are a lot of people.
We're just silent and hiding.
Yeah, I'm like, oh. You're fine. I don't know.
Oh, you should go. You know, yeah, there is my carrot.
It is insane.
I am.
Ladies and gentlemen, Mike Elpers.
Good morning, Commissioners. Mike Elpers, your CIO. Today, or this morning, I'll be presenting the Technology Review Board's 2025 budget request. Just a little background and history first. So the Technology Review Board, or TRB, was established in 2019 as a way to assist and review the acquisition and maintenance of technologies throughout the county. We assist departments to review, approve, prioritize, and frequently fund technology being considered by all divisions, departments, and programs throughout the organization. The policy is also intended to centralize the process of managing IT projects to determine whether or not the desired new technologies are appropriate for our infrastructure, to avoid the purchase of duplicate technologies, and to ensure the technology products are in line with the county's strategic plan. Additionally, with all the cloud solutions that are now available, we always take the time to review projects from an IT security perspective to confirm that any sensitive data that may come into play is secure. I'll just say TRB is extremely valuable for IT
TRB gets IT involved early on when things can still be changed or different implementation options can be explored, and when the inevitable timeline crunch for go-live is not critical. The Technology Review Board consists of 7 voting members. Most are from the leadership team, but we include several others in the meetings to make sure we consider all aspects of the project planning and some additional IT folks to help manage larger project implementations and plan ongoing support needs. Okay, so this is the list of A-rated projects TRB approved for 2025, which require additional funding, 10 projects total. Some of these are new technologies being implemented, while others are simple hardware refreshes or upgrades to existing solutions. My plan is to talk you through each of these and just give you some basic information about them as well as the costs. There's also a lot of information about these projects on our TRB website on eLine. And other IT and departmental resources are here today to provide more detail or answer any other questions that you may have. I tell you, if it's okay with you, Chairman, if there are questions along the way about any of them, can we just take the questions as the projects come up and not wait till the end?
I think that's probably smart.
I think that'd be the better way to go.
Good to go.
So let's get started. First one's a doozy. First project is one we've had on our radar for quite some time. It's an organizational move to the latest Microsoft Office platform called Office 365, or O365 for short. The move is for all purposes pretty much required, as just like other software packages and solutions, MS Office has an end of life associated with it, and vendors will require you to upgrade to stay current in support contracts and keep the ability to apply patches and updates. The big change here is that with prior versions of Microsoft Office, Microsoft has always used what we call perpetual licensing, meaning you buy the software and it's yours to, you own it, basically. With O365, however, Microsoft, like many other software vendors, has shifted its licensing to subscription-based, which means you basically lease the software from Microsoft with an annual fee, and you'll see that fee on the next slide. For now, this is what Office 365 includes, and it's quite a bit. Not only are the newest versions of typical Office products installed, like Word, Excel, Outlook, PowerPoint, etc., but O365 actually includes the email system license, called Exchange, and the SharePoint system license, the license for what we would refer to as eLine. Our perpetual license we used to buy for these two solutions, Exchange and SharePoint, are now included with O365. There's also quite a bit of online storage included, both in terms of mailbox storage and just plain file storage as part of their OneDrive solution. So if you're tired of getting your mailboxes running out of space messages, this should remedy those. Microsoft offers three different versions of O365 for government, specifically G1, G3, and G5. We're going with the G3 license, which includes all that I mentioned on the previous slide, but some special types of applications with very specific functionality. Things like MS Forms for surveying, MS Bookings for appointment scheduling, and Power Automate for attempting to automate simple and redundant types of tasks. As you know, we've had some departments move to O365 already, and we've had a few have been experimenting with some of these special applications with various degrees of success. It's been a learning experience for them and a learning experience for IT too. Some of those require some additional security controls, and we've been kind of challenged to allow some of these on our network. Regardless, though, we expect the usage of these solutions to evolve and become more familiar over time. Because it is a subscription license, and because O365 contains all these functionalities, it eliminates some of the previous capital expenses. Server hardware to support Exchange and server hardware to support SharePoint goes away. We expect that data storage array usage will also decrease. So the amount of space required not only for data storage, but also for the backups of that data should decrease, lowering the capital purchases of those. The cost of O365 is rather large, however, just over $1.1 million in 2025, and that will increase in 2026. Our contract with Microsoft for O365 has an annual renewal in September and is locked in for 3 years. So it will increase 5% in 2026, and then we expect it to increase an additional 5% in 2029. It's a very large and impactful project for our organization, and we could talk about it for hours. I could put up lots of different slides about it, but I'll stop there, address any questions that you might have about it. And there are others in the room. James Arntz in IT infrastructure has put in a lot of time on figuring this project out, as well as Chantel Crossman, Matt Hare in our BSG group. So we should have answers for you.
Questions? I would just say that I've already transitioned over to Office 365. I had to, and it was a very seamless transition for me. So, and there was a lot more user capacity.
Great.
Yeah, significant. Go ahead, Jim.
I'm curious, on Office 365, if you don't have a connection, though, can you access your data? Your data is only available if it's connected to the cloud, correct?
Are you meaning internet connection at all?
I'm just saying you have to have a connection. Say I take my computer to an event somewhere. I don't have a connection, but I created a spreadsheet while I was in my office. Go to the event, and I would bring up my spreadsheet. Now I don't have access to my spreadsheet because it's in the cloud, and I don't have access to I don't have an internet connection at that point.
It depends where you save it. If you have it saved just specifically in your OneDrive and you don't have internet connection and you don't have that copy on your machine, then no, you're not going to be able to access
But
it.
the software itself that runs 365, is it also in the cloud, or is it on the machine?
It depends how you have it set up. And you can have it set up many different ways. With OneDrive, you're able, on a county machine, be able to sync it. So you could have your live copy on your machine without internet, do all the work you want to do. Once you connect to the internet, it will sync it up into the cloud for you. So you're able to continue working, and vice versa. So say you're working on document from home and you're working through the cloud and you come back to work, it'll update that copy on your machine for you.
But I'm saying that the Microsoft Word, the Excel, PowerPoint, those programs are also in the cloud.
No.
Are you saying you have copies on your?
Yes, I'm sorry, I misunderstood. Yes, the actual physical copies of the application is on your machine. So you can work just fine, just like normal now. You can use the web versions that are in the cloud if you don't have it on your machine. Say you're using, say you're in a hotel and you need to be able to get to your documents and you don't have your work PC with you. You're able to access your documents that are in the OneDrive using the web version of Office, Word, Excel, PowerPoint, whatever you need, and it will save that. But you're able to do either or.
So if I save my latest and greatest copy to my C drive, is on that, so it's on my hardware, and then I guess my question would be, is that revision of that document different than what's in the cloud? I know it's always trying to drive these things to the cloud. It's a little bit frustrating to me to not know exactly what, which copy is the latest and greatest. I assume the one in the cloud is the most recent, but I'm not always sure about that. So it's just to add some confusion to me exactly where the latest document actually is.
So a good example I could give you is, let's say you are syncing to the cloud. You have it's synchronized with your work PC. Whatever document you're working on, at the upper right-hand corner of the document, it'll either give you an X or a check mark. If it is a check mark, that means that it is synced and you're working from the latest, greatest document. If it has an X, that means it's not synced and you're not working from the latest, greatest one that you're working on. So it hasn't synced up yet.
And my other frustration is if I'm using some really large documents and I make some minor changes, it wants to update those changes immediately, which takes my computer to its knees, and I have to wait for it to come back and finish saving a small change. Then I make another small change and does it again. It's always trying to save, if you will, without me telling it to save. It's trying to save those changes as they're happening. And when those changes, I assume it has to rewrite the entire file. Sometimes those files are so large that it's making it difficult to use that cloud-based document.
Right. And what we could do, we could take that one offline and we can take a look at what's going on with your machine too, to see what we could do to help remedy that speed issue that you're having.
One other question is, if you have employees that prefer to use Apple PCs versus whatever else we use here, is that an option for our employees to use Apple?
Not internal to the county, but if they're using an Apple machine at home, yes, it works the same way. You can install the same Office 365 license. It doesn't cause an issue there. And you can sync the files back and forth without any issues.
And the cloud-based storage location, is that a county provided, it is a county file location that we provide, I assume.
It is actually provided by Microsoft, but it is in what they call the government tenant. So, excuse me, it is protected by CGIS, HIPAA, DOD. There's a lot of different FIPS. I'm sorry, not DOD. DOD is the next level up, but we have FIPS compliance. There's lots of compliances that go into the protection here. So the data actually stays within the continental United States. It doesn't go to Alaska. It doesn't go to Hawaii. It doesn't go anywhere outside of the United States.
And I assume it's all encrypted so that someone gets into there, they can't.
Correct.
Okay. Thank you.
You're welcome.
One angle on that question, I think the G1 license that we opted not to pursue is only the web-based applications. The G3 has them installed locally. Yes, question?
This is the direction we're going to have to go no matter what. So the decision is pretty simple. But the question I have is that it eliminated a lot of things. You've got 4 bullets up there that eliminated. So the total cost is not 1.1 million or 1.2 million. In the future, we need to subtract that. So you don't know what the actual difference is?
I could guess, and I could say it's about a quarter of this current cost, but that would be a pretty out of the blue kind of guess.
Okay. But the point I was trying to make is this cost is actually reduced by what we have.
Absolutely.
We're saving on the capital. So the total cost to the county, it is going to be this, but what the change is from this request is not as great as it looks.
Not to mention all other departments and their current practice of buying the perpetual licenses for Microsoft Office. All of those expenditures go away as well.
And we can put that number together for you, but I will promise you, don't get super excited.
Yeah, it's still more.
Thank you.
Okay. All right. Excuse me. The second TRB project is one that has been in the works for a while as well. It is an upgrade to our existing Aumentum system used mainly by the county clerk and county treasurer. The solution is critical to the operations of the appraiser's office and register of deeds as well. The system has been around for a while and has gone through several upgrades and name changes in the past. The new version, the one we're targeting for 2025, is called Aumentum Platform, and this project will not only upgrade to that software, but also move it to a hosted or cloud solution. The upgrade comes at a pretty substantial cost in 2025, $848,500, but the annual maintenance fee doesn't change that much from what we pay today. The costs shown here in years 2026 through 2029 are for the hosting of the system, which is a new cost for this solution. There are several here that can speak to the functional need for the upgrade and what this project improves. But the very short story is that the system in its current version has been around for about 12 years and is limiting some of the functional improvements our row offices would like to implement. And the only way to move forward with those improvements is to move to this new platform offered by the vendor. I will say 12 years is a long time for a solution, a software solution, to be productive. Most large systems like this rarely make it 10, just due to the way software technologies change and advance. So any questions on this project? We've got a lot here in the room. Some of our electeds are here to answer anything that you have.
Yeah, any specific questions or anything for, let's see, Kelly's here, Randy's here. Anything?
Okay.
I think commissioners were all briefed on this.
Yeah, we've walked through this a few times, so.
The third 2025 TRB project is actually a project that was approved by TRB 4 years ago. It is an electronic health record system, or EHR system, for the health department. It never made it to a budget presentation that year because it did not need funding. It was initially funded by the CARES Act, and subsequently funded by ARPA dollars. It is before you today because the funding source for the project is going away, and Health Department now needs budget authority to continue using the solution in 2025 and beyond. The solution is actually made up of 3 systems. Athena EHR is the records management solution, which includes billing functionality. Cost is estimated to be around $76,000 in 2025. Panther is the annual contract to supply, repair, and upgrade services to lab equipment, expected $28,000 in 2025. And Orchard, which is a cloud service annual contract for storage and interface between Panther and Athena, $57,050 in 2025. So a total project cost in 2025 of $161,050, estimated to increase by 4% each year thereafter. Now, the cost of the Athena HR system is licensing, but also 7% of the revenue that it creates. So that $76,000 is just an estimate, but also Health Department estimates about $700,000 in revenue in 2024. And they predict this amount will increase annually, so the revenue they generate using the solution more than covers the cost. Any questions on this project? Okay.
Go ahead.
The 4th project is on behalf of the Sheriff's Office, and it is for an upgrade to a system they use for crash site or accident documentation. It's called Scene PD. It is actually software which is installed on the sheriff MCTs and used at a crash site. Today, they and 4 other participating law enforcement agencies use version 6, and they need to upgrade this to version 7. Now, the solution integrates with their Tyler Technologies Records Management System, or RMS, and RMS cannot support both version 6 and version 7 at the same time. So every agency using Scene PD needs to upgrade to version 7. They can't do it one at a time. Some of the participating agencies, I think it's Mays Police Department, I believe, are ready to upgrade, but since others may not have the funding to do so, the Sheriff's Office hope is that the county will provide the licensing of version 7 to all participating agencies, 8 of them total, all of them using the RMS platform. This is in line with how the RMS project was implemented, getting all affiliate agencies on a single platform for consistency and simplicity. Implementation costs of $64,500 in 2025 covers licensing, integration, configuration, and maintenance for the Sheriff's Office and 8 other law enforcement agencies in the county. Annual maintenance costs at $12,800 in 2026 and increase 5% in the following years.
Okay.
Any questions on
Yeah, I think we probably do. Go ahead, Commissioner Dennis.
Thank you. The big police department that I don't see up there is Wichita, because they didn't go to our records management system. So that leaves a big hole, because probably the largest organization that needs to document this is Wichita Police Department. So when we're missing that one big police department, why are we funding the other ones? Why not just take care of ourselves? What's the difference in cost if we just take care of ourselves?
Good morning, Commissioners. Keith Allen with the Sheriff's Office. The main issue is due to the fact that we're unable to upgrade the version, like Mike was saying, one piece at a time. So there's 10 agencies, the ones listed, that all are currently using Scene PD 6, and that version is going out of support. It's no longer supported. When we brought the other 9 departments on as an effort to, collaborate and share information and have one solution, we took the angle of providing this product to these agencies. The problem is if we have 9 of the agencies that have the funding and 1 doesn't, we can't upgrade to the system. So if we just took care of ourselves at this point with the Sheriff's Office and upgraded, if some of the smaller agencies didn't get the approved funding, we'd be stuck where we can't have 2 different versions, and then none of the 10 agencies, if we try to do that, would be able to document accidents the way the state requires.
Wichita's not part of it.
No, sir, Wichita's not on our system.
Then why do we care about all the rest of them because the bulk of the accidents is going to be in Wichita.
Everybody in the state of Kansas has to have a KDOT-approved accident reporting diagram system. It could be different ones. We don't all have to be on the same system. Correct me if I'm wrong,
Yes, sir.
Keith, but what we're trying to do here is take care of the sheriff, and then there's 9 ancillary departments that I would imagine in the real world, you guys will both be going to a scene, say, and the LPD and sheriff. It'd be nice if they were interfaced so that they could use the same reporting software. Wichita will have to have a solution on its own. I'm looking at Rusty. I don't know that we know what their accident diagram requirement solution is for KDOT, but they have to have one. I don't know what it is, but it's not this. So they can have their own. It's not we all have to sync together. They just have to satisfy KDOT.
So my question going back to it is, what is the additional cost for adding the other 9?
That's a good question.
You know, Catherine, I was going to say we can break it down. It's broke down by sworn officers of the total numbers. I don't know that did we receive a quote for just the sheriff's office?
Good morning, this is Catherine Helms. So with the record management system, we only have 10 agencies, including the sheriff's office on it. This is only for those agencies on our record management system. So if we included Wichita PD, they're on niche, a total different application, and they would not be able to talk to our record management system. So we're only trying to take care of those agencies on our record management system that we share.
I understand that. I was in the meetings when we were trying to convince the city of Wichita to become partners with us. And we had the sheriff, the DA, the mayor of Wichita, we had the city manager, the county manager, everybody sat in the room saying that we needed to go to our own records management system that's compatible across the board. And the police chief at that point in time refused to comply. He decided to go his own way and picked up a piece of crap called niche. And they're stuck right now. It was a mistake, but that police chief was a mistake also. So as we move forward, I want to know what it's costing us difference.
Can I jump in,
just-
please? I think what we can do is contact each of these agencies and find out if they're going to budget to do this, and if not, the hindrances and the reason TRB gave them an A rating is because this holds, if we don't do this, any one of these agencies, because they're on our RMS, will hold up our sheriff from being able to upgrade. So I think we can get some of that clarification. We still have a month and a half before we come back to you with a recommended budget, so we can get that clarified between now and then.
And just for clarity, on this decision package, when we did the RMS transition, we picked up the other agencies, and I think the county just took that on.
Yes.
Is it the
We
same
wanted
formula
to.
here? We're going to be picking them up. So the fiscal impact, Commissioner Dennis's question on the fiscal impact of what the 9 small agencies are costing, that's the question on the table that
Yes.
we need to get you an answer for. Okay.
And right now, those 9 and Sedgwick County, right now, currently, we're on the same system,
Yes.
correct?
Yes.
Okay. The 10 total, yeah.
When we were going through the process to purchase CAD, RMS, JMS, and looking for an integrated system where 911 and the sheriff were all on a compatible system that was integrated, there was also some desire to bring Wichita in, but also the sheriff came before the commission and asked to bring other agencies in so that they have a single source of information. When he does crime analysis, he has data from all of these communities around so that they have comprehensive data in a single database. He's going to need to communicate to those communities that we no longer are going to honor what we did the first time.
What are the odds we can convince Wichita when they come off a niche to come in the same direction? Do you think that's a conversation worth re-engaging?
I personally do, but
Rusty and I just had a meeting with the manager and assistant manager at Wichita. They are understanding now that they have to abandon niche. They're looking for options. I think the time is probably right to have that
Get
discussion.
the sheriff and Chief Sullivan sit down in a
It's
room
been
and have
mentioned.
Between chief and
Correct.
sheriff.
It's been mentioned. I don't know to what extent Wichita is, where they're at in their process.
Well, let's see if we can talk our sheriff into.
I would include, I think chief and sheriff plus Alora ought to have that discussion so that there's a good synergy there.
Okay.
Let me just offer a different perspective on this. We tax the people in Hayesville and Valley Center and Derby and all those cities, Keachai, we tax them. We provide a county-wide service potentially at least to these 10 departments. They could tax themselves and they could do it on their own and we could charge them, or we could just provide a service. You talk about consolidation of government. When we take over responsibilities for a city, that's the best type of consolidation. This is not a bad model. I understand we can get divided about whether they should or should not pay, but at the end of the day, we have access to tax their citizens to provide this service, and it's simpler to do it the way we're doing it. I'd rather leave it alone. In fact, I'd like to encourage Wichita to do what they should have done the first time, and they should be part of this as well. They shouldn't be on their own. We should do this countywide. That's the way I would rather see this. And again, cities can do it on their own if they want to, but the better model is for us to do it for them.
Yeah, I agree. Okay. Well, that was fun.
Yeah.
Any other questions, commissioners?
All right. Yeah. Hey, thank you, guys. Thank you.
All right, project number 5. This is presented on behalf of MABCD, and it is a move to a new licensing and permitting solution. They currently use a system called Hanson, and kind of like the Augmentum system in the treasurer's and county clerk's offices, Hanson is due for an upgrade. The plan with MABCD, however, is not to upgrade, but to seek out a replacement system. They are in the process of forming a request for proposal, or RFP, and are looking for a hosted solution to avoid capital purchase of hardware and leverage new functionality available in a contemporary solution. The pictures at the bottom of this slide represent only a few of the vendors and solutions that are available. As you can see, they leverage their technology quite a bit, processing 10,000 inspections a year, 30,000 permits, and 1,000 plan reviews annually. And while they do still offer in-person appointments for the public, they offer all of their services online and encourage citizens to utilize the virtual options. We estimate 2025 costs to include $250,000 for implementation and training, as well as the first year of annual cost of $175,000. Like I said, these numbers are pre-RFP, so they are likely to change, but based on our research of these types of solutions, these are our estimates. I should mention the current annual maintenance for Hanson solution is about $125,000, so we anticipate an annual budget increase of around $50,000, the difference. Any questions for the MABCD project?
Just make sure I understand. So this TRB is going to provide the software upgrade, but the funding for this is coming from MABCD. They provide through fee fund. They're going to provide the funding for TRB to do this, correct?
Correct.
Thank you.
Okay. On to projects 6 and 7. So the next 2 slides have 2 projects on them each. The projects are very similar. They're what I'd call a hardware refresh project. That is, we've got existing hardware or software that's going end of life, meaning it will no longer be supported by the vendor. Vendor will no longer release software updates or patches for it, that kind of thing. Software updates and patches, though, can be critical to us, especially on cyber-related hardware, as this hardware touches the internet and can be exploited by bad actors to gain access, steal data, disrupt operations if not kept up to date. Projects 6 and 7 both fall into this category. So ASAs, or Adaptive Security Appliances, are basically network routers going end of life. We have 7 of these in use at the locations you see listed there. I'll get those acronyms for you because one of them stumped me. Children's Advocacy Center, EMS Post 11, which is the one in Derby, Exploration Place, Harry Street Mall, Law Enforcement Training Center, our Stillwell campus, so the Public Works, Fleet, Sheriff's Property and Evidence, Elections, and Wichita Children's Home. So ISRs, or Integrated Service Routers, are also routers basically going end of life. We have 3 of these being replaced, and all are at Public Works locations. Replacing all 10 devices, 7 ASAs and 3 ISRs at a cost of $16,000 is project number 6. I will mention we are going to try to do this, IT is going to try to do this internally before the end of the year, but if I can't say at this point of the year whether or not we're going to have $16,000 to do it. But if we do, as we get later in the year, we'll take care of it on our own. Project 7 is software going end of life on our web application firewalls. We have 2 of these. This is the system we use for all remote access to county IT resources. So if you're familiar with accessremote.sedgwickcounty.org, that's the address to our web application firewalls. We also use them to protect our county website and some other public-facing applications. Obviously, a very critical part of our infrastructure and cybersecurity program. The last version we purchased was in 2018, and we expect a similar life cycle for this version, about 6 or 7 years. Update costs are expected at $75,185,000, which is a one-time cost. There is an annual fee associated with these, but that annual fee is already part of an existing IT budget. Any questions on these? Okay, projects 8 and 9 are also kind of hardware refresh projects, and these may look familiar as I bring these to you every year. This is the replacement of roughly 1/8 of our county PCs, including laptops and MCTs, and 1/4 of our fleet of iPads used by EMS and fire. We're asking for a few more PCs this year, as October 2025 is the end of support for a widely used operating system, Windows 10. It is imperative that we make this upgrade for departments dealing with HIPAA, CJIS, and PCI data to stay compliant with their industry standards. But we really want to keep all county computers on our network running Windows 11 by October 2025. We've been rolling out computers with Windows 11 operating system for a while now, but we've got a ways to go. And our customer support manager, Eric Robertson, is confident we can make this deadline. We just need a little bit more hardware next year to make that happen. We typically ask for about $325,000 or $350, but this year we're asking for $425 for this. If you do the math, speaking of numbers, on that $425,000 request, you'll find we have a little over $11,000 in kind of a buffer. So a lot of times we need additional cables or connectors and such, or processing requirements on a PC may be a little more than what we normally use, so that $11,000 buffer accounts for that. As for the iPads, we have 145 iPads in use in EMS and fire. 125 in EMS and 20 in fire. So the iPad request is to replace 31 iPads for EMS and 5 iPads for fire. Again, our target life cycle is 8 years for PCs and 4 years for iPads. Any questions on this project?
Questions?
Okay, the last one, the final 2025 TRB project. This is a fairly new technology dealing with system backups, and I'll try not to laugh when I'm doing this. A lot of recent things going on here. Today, we back up our servers periodically, mainly every night, to some off-site storage. Now, that off-site storage is always online, so that whenever we need it, we can access those backups and perform restores. We test this for restoring servers about once a month, but we restore individual files all the time, several per month. So having online access to backups is required, but it also introduces some risk in the event of a ransomware attack. These types of attacks encrypt an organization's data. Once encrypted, the attacker asks the organization to pay a ransom to unencrypt that data. Backups are the first thing these kinds of attacks target, knowing that if the data and the backups are encrypted, the organization has no choice but to either give up their data or pay the ransom to get their data back. Air-gapped backups are a solution to this. We still perform the online backups just like we do today, but then copies of those backups are copied and sent to cloud storage. After the backups are copied, the connection of those backups is broken, or a gap is created between the online backups and the backup copies, so that if we do fall victim to ransomware, we have unencrypted copies of those backups to leverage after everything gets kind of cleaned up. This was a recommendation from CISA, the Cybersecurity and Infrastructure Security Agency, when we engaged with them for penetration tests last year, and several organizations are putting air-gapped backup solutions in place to address this risk. This doesn't replace any of our current backup systems. It's just an addition to it for additional data protection. 2025 cost for implementation and the first year of subscription is $158,552. Then annual fees of $131,940 in the years after 2025. Any questions on this project?
Just to understand how it works, what happens if the attack happens while you're doing that transfer?
I think that's an excellent question. I'm going to refer you to James.
So typically how it works, what this software actually does is it analyzes the data that's being brought or sent up into the cloud. So it actually looks for key signatures in the data that's being transferred for ransomware or anything that's out of the ordinary. And then it'll throw up an alert. It can shut that connection off once it starts seeing the issue to protect itself. But the data that's already up there, it's what they call a mutable backup, which means even as an admin, I can't go in there and delete it or modify it. It is set for a specific amount of time, and that it sets until the timer runs out. So we can access the data, we just can't delete it or modify at that point. So if it does something bad get up in there, it's not going to wipe everything out. You would mark that as a bad instance, and you just wouldn't use that instance while everything else is still available.
And one other question, I would assume you don't just have one backup. You've got several days. So if something happened, you would detect that. You can go back if you had to go back a couple of days. You could do that.
We're
You have
talking,
several backups.
yeah, we're talking months worth of backups.
Perfect. Wonderful. Thank you.
Good. Any questions for Mike on TRB?
Just a summary slide here. Here's the list of 2025 projects showing the 2025 plan expenditure and 2026 expenditures for those that have recurring costs.
Okay.
And that's it.
Mike, I'd just say that, I mean, I've only been here a little over a year, and TRB was one of the things that I noted pretty early, just how efficient I think this board works. This is a big organization with a lot of different departments and a lot of different uses and functions, and I think this is that conduit to help meet technology needs that are necessary for an organization that does what this organization does. So I would just say that I think TRB is one of the more impressive things that we have for Sedgwick County government. I appreciate how thorough you are and your board in making these decisions and bringing this to the BOCC for funding. It's really impressive.
Great. Thank you, Chairman.
Okay. Lauren, what do you think?
Okay, we're on lunch break until 1 o'clock.
We're hungry, aren't we?
Yes.
Okay.
If I'm late, I'm late. I'm sorry.
Thank you, everybody.
Back as soon
You're
as I can
fine.
be.
You're fine. Just text me. You're good. I'll let everybody know that you have an important lunch.